Welcome to the PCOS Fertility Health Podcast. I'm your host, Dr. Angela Potter, and today you are going to learn what your options are if you're in that situation where you've been told you have PCOS and IVF is your only option to get pregnant. But you want to know what your options are. You want to have more conversations about what's going on in your body before moving forward with the IVF conversation. And so today you are going to get a little tutorial from me on what you can be doing if you're getting that advice from your doctor, if you're feeling pretty shut down and not being able to understand what these other options are for you. I'm super happy to have you here today. I am the creator of the PCOS Fertility Protocol, and I am also a speaker. I have shared the stage with leaders from companies like Google and Microsoft and Headspace. There is a lot of fun happening over on Instagram, so I want to be sure that you are connected over there. You can find me at Dr. Angela Potter. Be sure to follow me over there because you'll get updates on new podcast episodes that are coming out and even more information about fertility misconception, missing links with the PCOS fertility journey, and just lots of juicy details that you do not want to miss out on. And if you don't have your copy of the PCOS fertility checklist, you want to go pick that up right now. That is my free gift to you that I created so that you can have these foundational 10 steps to understand what to put in place for your body that your body with PCOS is looking for in order to get to a place where it has optimal fertility. So this checklist is just really straightforward. You can make sure to check off things that you have in place already, and just know that if you're missing any one piece on that checklist, then you have a missing link in your fertility journey. And there are options available to get that in place to help optimize your fertility health that much more to help you start seeing results. So head on over to drangelapotter.com/checklist, and you can download that free checklist. It also has a list of fertility labs that I recommend. So very helpful resource that I have put together for you. Head on over and pick up your copy. And I just want to acknowledge you for showing up here at this podcast, because you could be listening to a million other podcast episodes right now. But you have chosen to show up here to listen to something that is going to support your PCOS fertility journey to move forward in the most positive way that it can. And even though you've been trying to get pregnant for the past 6 years, you are holding on to hope and you are continuing to flood your brain with fertility hope and to get answers so that you can get the results that you're looking for. And that speaks really highly of who you are as a person. And I am really honored to have you here. And you are here in the right place if you have been trying to get pregnant for the past few years and you've been working with a doctor who has told you, well, you have PCOS, you're going to need to go through IVF to get pregnant, and you've got some basic testing done. All of that testing has come back fine, using air quotes there. And you're told, okay, just everything looks fine. So when you're ready, come on back for IVF. And that just doesn't sit right for you. You know that there must be something happening that's keeping you from getting pregnant. Because in the back of your mind, you're thinking, well, 2 + 2 should equal 4, right? If everything looks fine, why am I not pregnant yet? And so you want to be putting in the time and the effort to optimize your health, to optimize your fertility, to understand the root cause of what's keeping you from getting pregnant. And you're committed. You know that it could take 6 months or more, but you know that doing this groundwork, laying this type of foundation for your health is the most important thing that you can do for yourself. Because you think about how a house can't be built on a foundation that's unsteady. You have to start with a solid concrete foundation in order to build up the house. And you're in this place where you know you need to be laying that foundation for your fertility health in order to then have the best chance at getting pregnant moving forward. And so this episode is specifically for you. So first, let's talk about some cons. First, let's talk about some pros and cons that I see with IVF. So the pro is, wow, what an amazing scientific advancement, and what a gift it is to be living in a time where IVF is an option, because it absolutely is a part of many successful fertility journeys. And that's wonderful to have that kind of advancement in science available to us. Now, on the other side of that, the con that I see is that so many women are being told that IVF is the only option for them. And they aren't given this foundational support to create this juicy, fertile environment in their body before moving forward with IVF. And we know that IVF is not the magical golden ticket for pregnancy, because if it were, everybody who wanted to get pregnant would be pregnant by now. And that's not the case. So there are still missing links, even with a therapy like IVF. One of the biggest things is poor egg quality. And PCOS sets you up in a variety of ways for having poor egg quality. Now, that's not to say, gosh, if I have poor egg quality, I'm never going to be able to get pregnant. Not at all. You just have to be focused on supporting egg quality, understand what different hormone systems and aspects of PCOS that are contributing to poor egg quality. High insulin, classic. And address those issues, be supporting your eggs as much as you can, get those specific nutrients on board that your eggs love to get juicy and healthy, and then moving forward with IVF. But that's the biggest problem, is that, and it's more the problem with the system than it is with the actual IVF therapy, is that women aren't given those plans before being told, okay, IVF is the next option. And you are in this situation where you have been told that IVF is the only way that you're going to get pregnant with PCOS, yet nobody yet has talked with you about creating this fertile environment in your body. But it's hard to be there in that place when you've been trying to get pregnant for years. Now you're diagnosed with PCOS. Your doctor is telling you that IVF is the only option, and that just doesn't feel right to you. And again, like 2 + 2 should equal 4. If everything on my labs that you've run so far looks fine, why am I not pregnant? Then figuring out next steps that work for your body is what's going to be most important. What I'm going to share with you today are some steps that you can take moving forward in order to support that fertility environment in your body to potentially get pregnant naturally. I mean, I see that in my practice. But at the very least, to be supporting those fertility hormones and nutrients in your body. So if you do need some fertility medications or IVF, you have that much of a better chance of it working. So as we get into this episode, use this information as a jumping off point, a conversation starter. Okay. The most specific and essential fertility information that you are going to get is when you're having a conversation between yourself and a doctor who understands these PCOS pieces and can take their knowledge of PCOS and fertility and mix it with your symptoms, what's been going on in your medical history, and merge those together to create a fertility plan moving forward. All right, so step number 1, when you're considering how to support your fertility health instead of moving forward to IVF, is to really consider the timeline that you are willing to give your body. Now, here's the thing. Sometimes your own timeline and your body's timeline, very different things, right? You probably feel that already. But being in this place where you have already been trying for a few years to get pregnant, and then being at this place where you now know that you have PCOS, you know that you need to be supporting the PCOS in order to move forward to get pregnant. And so you need to really sit with yourself, to figure out what sort of timeline moving forward that you're willing to give yourself. Now, 3 months is really the absolute shortest amount of time that I recommend. And that is because we know that egg quality turns over pretty rapidly in those 3 months. And so the support that we give eggs today is supporting the eggs that are ovulating 3 months from now. So that is the shortest amount that I recommend mentally wrapping your head around. Now, optimally, you want to give yourself 6 months or 10 months, maybe even a year or two. Now, this is going to depend on a couple of factors. It's going to depend on your age. It's going to depend on your symptoms, what's showing up in your lab results, what kind of deficiencies are there, what hormone imbalances are showing up. It's going to depend a little bit on your family history, your environment. It's going to depend on your mental health during this whole process. So those are things to take into consideration when you're thinking, okay, how long can I be really focused on creating this optimal health in my body before I'm ready to say, if you aren't pregnant by then naturally, okay, let's move forward with some medications or different therapies. And this is really good to have that conversation with yourself, do some journaling around, talk about it with your partner to make sure that you are both on the same page about that. And then it's good to have that conversation with a doctor to say, okay, this is what I've been thinking, but can you share some extra thoughts on this based on what you're finding in my lab results and what you've seen working with other patients? So once you have that in mind and you're willing to give your body a few months to a year to create this really solid fertility foundation, what do you do next? Well, that second step is to get some clarity on your PCOS and your fertility needs in your body. One is figuring out your PCOS type, and then the second is getting some comprehensive labs done to look at what's popping up in your fertility picture. So with the PCOS type, I've got some podcast episodes that are specific about the type, so I'm not going to go into a lot of details here. You can head over and listen to those episodes. I'll include the links here in the show notes. There's 4 types. You could fit into one of them. You could fit into all 4 of them. But the most important takeaway is that you get your PCOS type figured out. Because once you have your type figured out, then that leads you forward on a fertility plan that creates an individualized plan for your body's needs. And PCOS does not respond to a one-size-fits-all approach. And so figuring out your PCOS type, that's the first step in getting that individualized care that's addressing these root causes of what's keeping you from getting pregnant. The second part in this clarity piece is getting the comprehensive labs completed. And this is a next step forward from getting just your regular reproductive hormones looked at, kind of those tick, tick, tick fertility labs to make sure we're ruling out certain things, which are very important. We need to have that information. But there's even more information that can be looked at to really understand that root cause of what's contributing to your fertility struggles. Because PCOS is honestly not a straightforward condition. It's not one of those conditions where we know exactly the enzyme system that is interrupted that contributes to PCOS. It's not that condition where we know absolutely it's this, one disruption in this one chemical process in the body. No, PCOS is a syndrome. It's made up of different symptoms that create the PCOS syndrome. And multiple systems in the body are interacting with that to create your PCOS and contributing to your fertility struggles, because the body works as a whole system. Everything is talking to itself, either directly or indirectly. These hormone systems, foods that you're eating are then creating this cascade forward. And so we can't expect that fitting PCOS into a one-size-fits-all approach is going to work, because we're seeing that that just isn't the answer. These medications are very helpful, but fitting everyone with PCOS into this one treatment plan for opening up fertility is doing a big disservice to many women. And that's why you're here listening to this and getting this next step for your health in order to create this really strong foundation. So you can get tests done that look at your gut health, which looks at inflammation in the body. And inflammation can be affecting your hormone levels, like estrogen. It can be affecting implantation. So you want to get that addressed and see what's going on in your gut. You can get tests done that look at antioxidant systems and markers that give us some really good information about, do you have the adequate antioxidants that your eggs need in order to become really good quality and become healthy and happy and juicy and ready to go make you a baby. You can get your toxic load tested to understand what toxins your body is holding on to that's then disrupting hormone systems that are keeping you from getting pregnant. You can get hormone metabolites tested to understand, okay, what are my hormones doing in the body? Now, blood tests looking at hormones, super helpful, but those are just a snapshot of what's happening on that day in that moment. Looking at hormone metabolites can help us understand this more global picture of what your reproductive hormones are doing. Maybe you have regular testosterone levels on a blood test, but when we look at metabolites, we see that you're pushing that more potent pathway of testosterone. So you're still getting acne and the chin hair, even though your blood test told you that your testosterone was fine. And pushing that more potent pathway of testosterone, it's still affecting your ovulation. So you see, by taking that next step to look at those hormone metabolites, you get that much more information about what's keeping your ovulation from happening. You can get your cortisol levels tested. Cortisol is your stress hormone, which if it's high during the day, as it so commonly is, then that creates this hormonal cascade of elevating blood sugar levels, which elevates testosterone and shuts down ovulation. And so we can actually look at those cortisol levels to see what they're doing during the day. And are they contributing to this whole fertility piece for you? Do you see how there's so much more about your health that can be looked into? And there's so many other systems that are interacting with reproduction and with your fertility that you don't want to let just go unlooked. And I know, like, you already know in your heart that you're like, I am committed to figuring out the root cause. Just show me the way. Well, this kind of testing is the way. Okay, so this is the testing that I run in my PCOS Fertility Transformation Program. This type of testing is available to you, and it helps you to get that next level of understanding what needs to be fixed to create this really strong fertility foundation. The third thing that you're going to need when you're moving forward on this path of supporting your fertility health before moving forward with IVF, potentially getting pregnant naturally before needing to have the IVF conversation. The third thing is a plan that addresses what's coming up in your body. Now, the trick is you need to be working with a doctor who can put all these pieces together, who can help you identify your PCOS type, who helps you with those labs, understands which labs are most important to your picture, because the labs that I talked about a minute ago, those are all really important. But then you do need to understand, well, what is most important for your needs? Because you have a different medical history than anyone else. And so are there extra ones that need to be done? Have you already gotten certain ones done? And so that doctor can help you understand that, which ones are going to give you the best information for your fertility journey. And then you need a plan that addresses that and helps to support the body in these different systems to address these root cause issues of your fertility struggles, to then create this fertile environment in your body. You need a plan that supports boosting egg quality, regulating hormones that are contributing to poor egg quality, making sure you have antioxidants and nutrients on board that your eggs need and you could very well be deficient in. You need a fertility nutrition plan that is focused on the foundations of nourishment and flooding the body with fertility nutrients that are going to create this environment for regulating hormones, keeping periods regular, supporting egg quality, and a fertility nutrition plan that is not one that says, okay, well, go lose 50 pounds and come back and talk to me once you've done that. And then you go home, you try fad diets, you try over exercising, and then you end up just crying yourself to sleep at night because you can't do it. And you feel like it's your fault that you can't get pregnant. No, you need a fertility plan that focuses on nourishment and how to create that fertile abundance in your body using food. So those are the 3 steps to focus on when you're in that place where your doctor has said, well, you have PCOS and the only way to get pregnant is through IVF. And that doesn't sit right with you. And you're thinking, there's got to be a different way, or at the very least, I've got to be able to see if my body can make changes naturally before I even move forward with that IVF conversation. So first, you're going to get specific on the timeline that you're comfortable with. You know it's going to take at the very least a few months. And are you comfortable with a year or 2? And then you're going to work on getting some clarity around your body, figuring out your PCOS type, getting some extra testing done to really take a look at this comprehensive at your fertility health. And then third, you're going to get a fertility plan in place from a doctor who can put together these PCOS pieces, who can fit together your PCOS type, your labs, your medical history, talk about how this is all going to work into your timeline, and a plan that addresses these root causes of your fertility struggles and help you to create this fertile abundance in the body. And so as you do that, what you are actually doing is creating that strong foundation for your fertility health. And that is the missing link for so many people on their fertility journey. Because a house cannot be built. It cannot stay standing on a foundation that is cracked and crumbled, maybe moldy. That house cannot stay up on a foundation. If you were doing some work on your house and you had an inspector come on over and they had to look at the foundation to see what this new addition on your house would be, and they see some cracks in that foundation, you're going to get some red flags. You can't do that addition until you fix this foundation, because we know years down the line that this will just all fall apart. Your fertility health is similar. You have got to create that solid foundation. Figure out if you have cracks. And by being here on this podcast, we know that there are already some cracks. I don't know which ones specifically for you, but if you haven't gotten pregnant yet over years of trying, there are cracks there. Figuring out where they are, what's causing these cracks, and then getting a plan that fixes that foundation, that creates this really strong fertility foundation for your health to help you move forward to get the best results that you're looking for. And taking the time to step back and focus on that foundation, even when you're wishing that it was the roof that was going on at this moment, that you were able to move into that house next weekend, you were able to get pregnant next cycle. You have got to take that step back to evaluate that foundation and to create the most support that you can to make it a strong fertility foundation in your body. Determining whether or not IVF is the most important next step for your fertility journey is a conversation to be had between yourself and a doctor. And if you currently don't have a doctor who is willing to have those conversations with you and is really focused on IVF being the next answer, even when you want to take that step back, If you're looking for a doctor who can help you have that conversation of how to create that fertility foundation, then I invite you to reach out and book a free call with me. And we will get on the phone to talk about what's been going on in your fertility journey. What are these missing links? What are these cracks in your fertility foundation? And what's the single most important next step that you can take in order to create that strong fertility foundation and get the very best chance at getting pregnant with PCOS? So you can sign up for one of those calls at drangelapotter.com/PCOS. My calendar will open up on that page and you can book a slot there. And a reminder that this podcast is for informational purposes only, and you need to be speaking with myself or another doctor in order to get the information that's specific for your fertility needs. And as we wrap up here this week, if nobody has told you this today, let me be the one to tell you that I believe in you. And I believe in your ability to have the very best chance at getting pregnant with PCOS. I'll see you next week.